Good afternoon, and thank you for joining us today for this important discussion on Israel's apartheid regime and its impacts on Palestinians' right to health, in parallel with the 46th session of the Human Rights Council. I would like to thank the speakers and co-sponsors of this event. My name is Nada Awad. I am the International Advocacy Officer with the Cairo Institute for Human Rights Studies. I will be moderating the discussion today. The Cairo Institute, with our partner organizations, are holding this event as part of an ongoing joint campaign against Israeli apartheid. The impacts of the global pandemic have brought into sharp focus Israel's denial of the right of health of the Palestinian people as part of its commission of the crime of apartheid. 7 decades of Israeli institutionalized racial domination and oppression have resulted in wide disparities between Israeli and Palestinian access to healthcare and their broader enjoyment of the right to health. Since the onset of the pandemic in March 2020, Israel has failed to respect, protect, and fulfill the right of Palestinians on both sides of the Green Line to health, a perpetuation of long-standing inequities. If you would like to ask a question to our panelists, please use the Q&A box at the bottom of your screen at any time during the event. We will try to answer as many questions as we can after the presentations. For now, I turn to Ms. Budur Hassan, legal researcher at the Jerusalem Legal Aid and Human Rights Center. Budur, you have the floor.
Hi everyone. So Palestine, like many other countries in the world, is marking the not very happy anniversary of the outbreak of the pandemic. And during the last year, the Israeli treatment and denial of access of care to healthcare to Palestinians has aggravated an already existing state of exception. The effect of the pandemic has not been limited to health, but it has been most acutely felt in the health department. Palestinian hospitals in Jerusalem have been suffering under Israeli occupation and Israeli negligence for so long, so that when the pandemic hit, many of these hospitals were ill prepared to deal with its repercussions. Palestinian hospitals have been unable to receive the overflow of patients who have been accessing these hospitals. Israel's decades of de-development in Jerusalem and on both sides of the Green Line has resulted in these Palestinian hospitals failing to accommodate many patients. In addition, Israel's restrictions against Palestinian rights to movement have prevented Palestinians from the West Bank from accessing these hospitals, already accumulating the pressure on Palestinian hospitals in the West Bank, especially in recent months, where many of these hospitals have been unable to deal with the escalation of the pandemic in the West Bank. As I said, the repercussions of the pandemic have not been limited to health, although they have been most acutely felt in the health department. Israel has also, instead of limiting or restricting its violations against Palestinian rights, Israel has exploited the pandemic and exploited the fact that many places in the world are trying to deal with the pandemic in order to escalate its violations against Palestinian rights, especially against the Palestinian right to housing. While many experts have said that social distancing and isolation is key in order to limit the spread of the pandemic, instead of actually accommodating that and instead of allowing affording facilities, Israel has escalated its campaign of demolition on both sides of the Green Line, particularly in Jerusalem. Over the past year, Israel has demolished 200 structures in occupied Jerusalem, more than half of which are residential structures, leading to the displacement of 430 Palestinians in Jerusalem alone. More than 1,400 Palestinians on both sides of the Green Line have been displaced due to Israel's demolition of inhabited and residential structures, not to mention the demolition of wash structures and the demolition of structures dedicated to sanitation. In addition, also, while many of us are concerned of what is happening on the ongoing pandemic, Israel, the repercussions of what will happen after the pandemic ends will be acute, both on the economic, health, social, and political spheres. And last but not least, Israel continued violation of the Palestinian right to receive vaccination in the West Bank is also one issue that needs to be tackled. The pandemic has left disastrous effects on the Palestinian community on both sides of the Green Line. It has not revealed, but it has rather aggravated what Palestinians have been suffering for the last 7 decades, both in Gaza, in the West Bank, in Jerusalem, and in the territories occupied in 1948 in what is present-day Israel. Any resolution to these problems need to tackle the pandemic holistically, not just to focus on health, but to focus on all aspects and to treat this regime as a holistic regime of apartheid that is meant to fragment and to develop the entirety of the Palestinian community.
Thank you, Budur. I would now like to turn to Dr. Taleng Mofokeng, Special Rapporteur on the Right to Health. Dr. Mofokeng, are you with us, or should we go to another speaker and come back to you? Yeah, okay. So Dr. Mofokeng was with a patient when we logged in. So I will now turn to Nuria Oswald from Al Mizan Center in Gaza.
Sure, thanks so much, Nada. So while life is returning to normal in Israel, the situation in Gaza is still desperate. There's a new surge of cases across the OPT that we're witnessing at the moment. And while this surge seems to be impacting the West Bank in particular, the virus in Gaza still continues to spread as well. The authorities in Gaza have registered more than 54,000 cases and 543 deaths. There's no lockdown or restrictions in Gaza in place at the moment, although the public is still encouraged to maintain social distancing and to be vigilant in terms of mask wearing. But the markets are open normally, and my colleagues reported an almost palpable sense of relief from the first very few doses of the COVID-19 vaccines arriving in Gaza and the rollout going smoothly so far. But Gaza's efforts to manage the pandemic were hamstrung from the start. Gaza has been under a brutal blockade and closure for over 13 years, unilaterally implemented, of course, by Israel, and considered a collective punishment under international law of the 2 million Palestinian residents of the Gaza Strip. Gaza is also the subject of regular military bombardments, which have led to the vast destruction of civilian infrastructure, including importantly, medical facilities and water and sanitation systems, of course, being key infrastructure needed to address COVID-19. And so the consequences of both Israel's closure and military conduct in Gaza have been a healthcare system on the brink of collapse and public hygiene greatly undermined, notably in terms of the population's ability to implement even basic safety and preventive measures for COVID-19, such as hand hygiene and access to wash. Gaza is also one of the most densely populated areas in the world, further undermining residents' ability to social distance. I also want to touch quickly on the disparity and starting points that we've witnessed between Palestine and Israel in terms of managing the pandemic. And to say right off the bat that this is due to 7 decades of institutionalized racism targeting Palestinians, which has caused a wide array of disparities between Israeli and Palestinian access to healthcare and broader enjoyment of the right to health overall. But these disparities, of course, predate the spread of COVID-19. But the pandemic has really highlighted the issues from the start in terms of access to materials and goods to manage the virus, particularly in Gaza, including things as crucial as PPE and ventilators, intensive care unit beds, medicines and expertise, inability of patients to receive adequate care for other illnesses simultaneous to the healthcare systems addressing COVID-19. And now we've reached the gaping vaccine disparities. Although Israel has inoculated a higher percentage of individuals against the virus than any other country, including vaccinating Israeli settlers illegally transferred into the occupied West Bank, including East Jerusalem, the state has denied equal access to vaccines for Palestinians living in the occupied West Bank and Gaza Strip. So in Israel, almost half of the population has been fully inoculated, according to its Ministry of Health. And in Israel, as I said at the start, the conversation is about life restarting, about life after the pandemic. In Palestine, the vaccination program has barely gotten off the ground. And I want to emphasize that Israel has a legal duty towards the Palestinians in the West Bank and Gaza Strip as an occupying power to meet the health needs of the protected population, including in regards to a pandemic. And these obligations require Israel to include Palestinians in the whole OPT in its vaccination program without discrimination. So far, just 2,000 doses of the Sputnik 5 vaccine were shipped to Gaza from the PA, donated by Russia. These were first delayed by Israel for political approval. And then in February, a shipment of 20,000 Sputnik 5 doses were delivered to Gaza from the UAE through Egypt. On the 10th of March, the UAE donated another 40,000, again, of Sputnik 5 to the Gaza Strip, and this is being attributed to the efforts of Mohammed Dahlan, a former Fatah official. So the disparity in access to vaccines, with Palestinians in the OPT having very little access and Israel leading the world in vaccine coverage, is a direct result of the apartheid and colonial aspects that characterize its occupation. These disparities are not new, and they don't only affect the healthcare sector. And so to conclude, the Human Rights Council and member states have an important role to play in raising these issues within the scope of the council, both in terms of support for the Palestinian authorities in terms of their COVID-19 response, and also crucially in bringing an end to Israeli violations of international law that lead to these disparities and result in the apartheid framework overall. And lastly, by promoting accountability, including by supporting the resolutions on Palestine, and by supporting the ICC investigation and encouraging the investigation of the crime against humanity of apartheid as well. Thanks very much.
Thank you, Nuria. I'm sorry I did not introduce you with your title, International Legal and Advocacy Director at Al-Mizan, Palestinian human rights organization based in Gaza. I now turn to Dr. Laleng Mofogan, UN Special Rapporteur on the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. Special Rapporteur, you have the floor.
Thank you so much for this invitation to just participate in this very important discussion. Sorry, I'm a bit late. I was also doing similar for different colleagues in other parts of the world. And just remind me quickly, how many minutes do I have? I'm sorry, Nada.
You can speak, for example, 7 minutes is okay?
Okay, that's fine. Thank you so much. Thanks. And I just wanted to say that, of course, as human rights experts, myself, as the UN Rapporteur on the right to health, with my other colleagues, did issue a statement that was calling on Israel to ensure swift and equitable access to COVID-19 vaccines for the Palestinian people under occupation. I think it's very important to locate, this discussion within immediately a human rights perspective, and that the right to health, as we speak about COVID-19, which of course, for the first time, I don't know in the globe if we've all of us simultaneously been captured by one single health issue as COVID-19 has done. But the right to health contains both freedoms and entitlements, and freedoms include, but not limited to, the right to control one's health and the right to information. And the entitlements include the right to the underlying social determinants of health that provides equality of opportunity for people to enjoy the highest attainable standard of health. And this right, of course, is interlinked, it's interconnected, and exists alongside other important rights, such as to reproductive health, bodily integrity, safety, and security. And you can see from the get-go, the many intersections that are existing already around the right to health. And it's not merely about access to health services. And the right to health is a right that has to be fulfilled not only if people meet certain criteria, but a right that has to be fulfilled, protected, and promoted for no other reason but because people are human beings. And COVID-19 has shown us that even at our best as the global health community, but you can look in different regions around the world, that we were really never prepared and that COVID-19, for example, the specific testing capacity, access to treatment, and a lack of consistent supply of clean water, for example, which are crucial for the prevention of the spread of the virus, continue to be structural deficiencies for many communities around the world. And the pandemic continues to highlight the structural fault lines, many which were already existing before COVID-19, and that there is currently inadequate resourcing of community healthcare systems, local healthcare systems, biomedical development and research, and public health information dissemination globally. Now, many healthcare systems have failed to provide adequate supplies of personal protective equipment, even to the healthcare professionals and the workforce who have been the backbone for many years of already fractured and ailing public health systems in many systems around the world. Now, inequality shapes the structural and systemic challenges that are borne unjustly by individuals. It's the individuals who bear the brunt of structural and systemic failures. And whether these are because of leadership or maladministration or corruption within the health system, ultimately, it is the individuals who bear the brunt of those failures. And a lack of accountability, a lack of transparency leads to a distrust and a discourse within the community that has led to what we now have seen as disinformation or misinformation and all of the related social media discussions that are false information and spreading false information and false science around the COVID-19 pandemic. But that, in fact, it's also through differential access to healthcare and the underlying determinants of health and other socioeconomic and other structural factors and how they interact with each other to generate and also reinforce negative health outcomes that affect people disproportionately. And we know in any situation, the disproportionate negative impact affects those who are already in vulnerable situations. And as with other types of changes and responses that different governments and states are currently busy with, we must be vigilant, right, to policy changes that leads to further marginalization and violation of people and the rights of people in vulnerable situations, and those who are already often neglected from health services, goods, and facilities. And we know, right, the issue around people who are experiencing homelessness, migrants, and refugees. And this means that more than 4.9 million Palestinians will remain unprotected and exposed to COVID-19, while in this case, Israel citizens living near and among them, including the Israeli settler population, will be vaccinated. And morally and legally, when you are using the bedrock of human rights as a guide, as your campus, we know this differential access to necessary healthcare in the midst of the worst global health crisis in a century is unacceptable. And that is where we draw our mandate, my colleagues and myself, as special rapporteurs. And of course, according to the WHO, more than 160,000 Palestinians in the occupied Palestinian territory have tested positive for the coronavirus since March 2020. And we know, as with the places that we all live in, right, whether you're talking about a national, regional, or global trend, that more and more people are being cut out of vaccination access. More and more people are getting and are testing positive for coronavirus since March 2020, and that the deaths right now in the Palestinian occupied territory means that the deaths that are related to COVID-19 are well above 2,000, and that infection and deaths have been rising steadily in the recent weeks. And whether you are talking about, by the way, people living with disabilities, older persons, you can see, and children, you can see how existing structural and systemic challenges have become and have led to even increased marginalization. And we must gain and commit to gaining a deeper understanding on the negative impact of this occupation and how even under COVID-19, we have seen worsening health outcomes. And some of the oppressive structures are embedded in the global health architecture. But even if you look at different regions in the world, such as the ones that we are talking about today, you can see how the existing negative health outcomes have been severely impacted by the COVID-19 pandemic. And we know that the figures that are coming out of the WHO, more than 50 million people confirmed cases, over 1.2 million deaths. We know that only they offer a glimpse of the exorbitant human costs. And I think that's the message today that I want to really leave with you, is that we have to put humans at the center of all of our responses, whether at the national or international level. We have to save the humans first. Worrying about the economy or industry is not going to get us where we need to get to, because without the humans, there is no industry, there is no economy. We have to save the humans first. And it's very important as part of the work that we do collectively within the United Nations, to really remind all of us that the right to health is a fundamental human rights issue, and that there is international human rights law that does guide us, and which applies in full to the occupied Palestinian territory, that stipulates that everyone enjoys the right to the highest attainable standard of physical and mental health. And the denial of an equal access to healthcare, such as the one based on ethnicity or race or displacement, is discriminatory and unlawful. And hence our call, whether it's on a national, regional, or international level, is for a respect of human rights. It's for a respect of the right to health as an independent right that everyone has. And that, in fact, we continue to emphasize, right, the scale and the human cost. And I think with no clear end in sight, we are required to have a concerted, principled, and courageous response whose bedrock is human rights, and that international solidarity, but also national solidarity, is very important, as well as cooperation and assistance. And there is no room for nationalism or profitability or further marginalization in the decision-making, as well as into the access of essential medicines, and of course, the COVID-19 vaccination. I will leave my comments to the Q&A as we further engage on this issue. Thank you very, very much.
Thank you very much, Special Rapporteur, for putting it within the larger picture, providing us this larger picture on the access to health and the access to vaccine. I will now turn to Ms. Shahat Qaddoura, legal researcher at Al-Haq.
Thank you, Nada. I'm excited to be here with colleagues and to see so many people joining this event, which is a sign of recognition and concern regarding Israel's apartheid regime, which is exemplified during COVID-19 pandemic. Of course, Israel's apartheid regime was established and maintained since the Nakba in 1948, as Budur and Nouriya have previously explained at the beginning of the webinar. A global pandemic did not stop Israel and its occupying forces from carrying out systematic, widespread, and unlawful human rights violations against Palestinians across the occupied Palestinian territory. Israel has continued to use excessive use of force and implement its long-established shoot-to-kill policy. Israel has also continued to conduct raids, arbitrary arrests, demolitions, destruction and confiscation of property, and policies of collective punishment, including the withholding of Palestinian bodies, and of course, the 13-year-long closure over 2 million Palestinians in the occupied Gaza Strip, as Nouriya mentioned. One of the issues of concern is Israel's continuous implementation of its discriminatory and unlawful policies and practices, which are intended to foster a coercive environment in order to force Palestinian transfer and sustain Israel's settler colonial regime, despite the fact that advocate housing is seen as the front line in fighting and mitigating the COVID pandemic, as demonstrated by stay-at-home and lockdown orders. Civil society organizations have documented an increase and escalation of Israel's illegal demolition of Palestinian structures on both sides of the Green Line since the start of COVID pandemic. Al-Haq has documented the destruction of 470 structures, resulting in the displacement of 811 Palestinians, including 382 children from 5th of March 2020, which is when the first COVID-19 case was confirmed in the occupied Palestinian territory, and until the 1st of January 2021. Just last month, the Israeli occupying forces raided Khirbet Homs al-Fawqa 5 times. Khirbet Homs al-Fawqa is a Palestinian community located in what Israel has declared a firing zone area and was previously targeted in November 2020 when the Israeli occupying authorities conducted what was described as the largest forced displacement incident in over 4 years, leaving 72 Palestinians, including 38 children, homeless. In occupied and illegally annexed East Jerusalem, 182 Palestinians, most of whom are refugees who had previously been displaced in 1948 and denied their right of return and reclaim their properties since then, are facing yet again the imminent threat of forced eviction through the discriminatory 1970 legal and administrative matters law because of the eviction lawsuits brought against them by settler organizations. While Israel's discriminatory, unlawful, and racist rollout of COVID-19 vaccines has made headlines, this practice is merely an example of Israel's apartheid regime of systematic racial domination and oppression over all Palestinians, which and for decades has led to the fragmentation and de-development of the healthcare system of the occupied Palestinian territory, especially in the occupied Gaza Strip. As previously highlighted by Nuria, international humanitarian law specifically says that the occupying power has clear obligations to ensure the protection and respect of the right to health of the protected population. So there isn't really anything complicated about that. The Special Rapporteur also highlighted Israel's obligations under international human rights law and under international humanitarian law. Until today, and throughout the occupied Palestinian territory, however, apart from East Jerusalem, the Israeli occupying authorities have reserved access to the vaccines to the unlawfully transferred Israeli settlers, denying the vaccines to Palestinians, aside from Palestinian workers working in Israeli settlements and in Israel. While Israel started its 2-week campaign to vaccinate more than 100,000 Palestinian workers with permits last Monday, it's crucial to emphasize that the rights of Palestinian workers have been long ignored and denied. Just to give an example, at the beginning of the COVID pandemic, and specifically on the 23rd of March 2020, the Israeli police left a Palestinian worker at Beit Sera checkpoint west of Ramallah in the occupied West Bank after he showed flu-like symptoms that were suspected to be COVID-19. Without any regard for his health, the worker was simply thrown and left at a checkpoint until a Palestinian ambulance came to take him without any prior coordination with the Palestinian Authority to ensure that he had received the needed treatment. While we've been calling for the rule of law and that Israel actually adheres to its legal obligations, sadly, and while this is no surprise, Israel is carrying out this campaign to vaccinate the Palestinian workers just to ensure that the protection and safety of its population, completely ignoring its legal obligations towards Palestinians in the OPT. Just to wrap up and conclude, I think it's very important to stress that when we look at COVID and the vaccines for Palestinians, the issue isn't just that Israel its discriminatory rollout of vaccines, but also decades of fragmentation of the Palestinian people and the development of Palestinian healthcare caused because of Israel's settler colonial and apartheid regime. Israel will continue to ignore its legal obligations as occupying power and maintain its apartheid regime over the Palestinian people as a whole on both sides of the Green Line and as refugees abroad as long as it's not held accountable. It's high time that the international community recognizes the root causes of the prolonged denial of Palestinian rights represented in Israel's settler colonialism and apartheid regime, and to take effective measures to prevent crimes and violations against the Palestinian people, including by fully cooperating with the ICC, which constitutes an important step towards an end of Israel's impunity and apartheid, and a crucial step towards long-awaited justice for the Palestinian people.
Thank you, Ms. Qaddura. I now would like to turn to Ms. Milena Ansari, International Advocacy Officer at Al-Damir Prisoner Support and Human Rights Association.
Thank you, Nada, and thank you everyone for attending and giving us your time. It is imperative to expose the gravity of the Israeli Prison Service's policy of deliberate medical negligence, as it has become an integral part of the Israeli occupying authorities' oppression of Palestinian prisoners and detainees, and another method to infringe on Palestinian prisoners' right to health and dignified treatment. Currently, there are 706 sick Palestinian prisoners in Israeli prisons, 300 of which are chronic illnesses, and at least are 11 cancer patients. In 2020 alone, 4 Palestinian prisoners passed away while in Israeli prisons. In light of the COVID-19 pandemic, the Israeli prison services and the Israeli military courts have escalated their violations against Palestinian prisoners and detainees. Israeli prison services failed to ensure the protection of Palestinian prisoners and detainees as they continue to as Palestinian detainees and prisoners are subjected to harsh living conditions that do not align with the bare minimum of adequate living standards. The overcrowding, insufficient ventilation, and lack of hygiene products make it nearly impossible to restrain the virus's spread inside prisons, leaving Palestinian prisoners unprotected and exposed to the rapid spread of the COVID-19. It's important to note that Palestinian human rights organizations do not have accurate and concrete numbers of Palestinian prisoners who have tested positive for COVID-19, nor about their health conditions, bearing in mind that Israeli prison services do not publish COVID updates for the public regarding Palestinian detainees. In March 2020, during the beginning of the COVID-19, the Israeli occupying authorities released around 300 Israeli common law prisoners who are serving lighter sentences and nearing the end of their time in prison. They were selected on the basis of their health and age. Yet the Israeli occupying authorities have not established the same release policy for vulnerable Palestinian prisoners, including administrative detainees who are held without charge. Detainees are no longer brought to court physically. Instead, they appear remotely from the place of their detention. The military judge, prosecutor, and defense counsel are all themselves physically present at court. Palestinian detainees have reported and objected to this practice as it further impedes their ability to adequately follow procedures. While the court provides the detainees with the hearing protocols afterwards in Hebrew, the vast majority of Palestinian detainees are unable to read Hebrew or understand the nature of the procedures, hence violating the right to fair trial standards and adequate defense. The physical and psychological ill treatment of Palestinian detainees includes being subjected to various forms of torture during interrogation without any form of accountability. Recently, the Israeli Attorney General closed the investigations against the security agency for the Israeli Security Agency for the circumstances leading to prisoner Samir Arbid's hospitalization and use of extreme torture techniques during his interrogation that almost killed him. Rather than pressing a list of charges against the perpetrators of such heinous crimes, the Israeli Attorney General decided that there are no grounds to prove that the crime of torture has been committed. Bearing in mind, Samir was hospitalized and was put under machines to help him with his health conditions. This indicates the Israeli occupation's unwillingness to investigate, prosecute, and hold those responsible for the excessive use of force against Palestinian detainees during interrogations. It also shows the incompetence of a system of supervision, leaving the lives of Palestinian detainees at imminent risk. Without receiving the immediate medical care needed, many Palestinian prisoners and detainees fall victims of the occupation's policy of deliberately stalling the implementation of the provisions of specialized medical care. We urge the international community and all parties of the Human Rights Council and all international parties to urge Israel to immediately release all Palestinian political prisoners from Israeli prison and to ensure their safety from the uncontrollable spread of the pandemic. And when we talk about the immediate release of Palestinian prisoners, this particularly includes vulnerable Palestinian detainees, elderly Palestinians, women and children, especially those who suffer from chronic illnesses and disease. Thank you.
Thank you, Ms. Ansari, for shedding light on the situation of Palestinian detainees and political prisoners. I would like now to turn to Ms. Amal Abu Sroud, Director of Programs at Women's Center for Legal Aid and Counseling.
Thank you very much, and thank you for giving us the opportunity to shed light on the gendered impact of the pandemic in Palestine. Actually, COVID-19 has placed an enormous stress on Palestinian health system, which was already significantly weakened and undermined by decades of Israeli occupation and systematic oppression. As an occupying power, Israel has a clear legal obligation under Article 56 of the Fourth Geneva Convention to ensure adequate food and medical supply for Palestinians and to maintain medical services, public health and hygiene, particularly during a pandemic. From the very beginning of the pandemic, Israeli authorities has consistently neglected their legal obligations under international law, and in several cases have even undermined or obstructed Palestinian authorities' attempts to care for Palestinian population. Restriction of movement for Palestinians enforced through settlement infrastructure and the annexation wall have made it difficult or even impossible for people to access hospitals and healthcare services, and for medical equipment, including testing kits, or to reach clinics. As with many impacts of COVID-19, women have been particularly vulnerable to the effects of not being able to access healthcare and health information. Israeli military measures continued affecting every aspect of Palestinians' lives. During the lockdown, Israeli occupying power carried out night raids, which is a systematic measure to intimidate Palestinians. Our evidence-based data and testimonies collected from women revealed that Israeli soldiers were not following safety measures put in place to prevent the spread of the coronavirus. In almost every night raid testimony collected by WICLAC, women expressed their fear of them or their families contracting coronavirus during a night raid or arrest. An additional burden placed on women is cleaning and sterilization of their house after night raids during COVID-19. It is women's responsibility to sterilize their houses and to make sure that safety measures are properly followed. Thus, any outside interference during the pandemic will result in extra work and further prolong the process of sterilization. To make things worse, dogs are intentionally brought by Israeli occupying forces during night raids. Our testimony summarized that the experience of many women. A woman said, "I cleaned and sterilized the house and washed the carpets that Israeli soldiers have stepped on with their shoes. The situation is difficult for me as I am a former cancer patient and my immunity is weak. None of my family or neighbors have visited me at home or to console me or support me since the arrest of my son, for fear of my health and to prevent the spread of COVID-19. As the occupying power, Israel has a general responsibility under international human rights conventions for the safety, welfare, and human rights protection of Palestinian children living in the Palestinian territory. Discrimination, there was the report, which I'm not going to focus on, but the report in general, which is a report which is funded by the UK Foreign Commonwealth, the report found violations related to the following legal obligations: discrimination, best interest of the child, premature resort to detention, no separation from adults, prompt access to lawyer, use of shackles, unlawful transfer and detention outside occupied territory, and failure to translate applicable laws. Testimonies collected by WICLAC show that care is not being taken in the arrest of and detention of children to protect them against COVID-19. A mother whose child was detained for hours by Israeli soldiers without informing her of the reason said, "I spent hours full of anxiety and fearing for my son. I was afraid that COVID-19 would be transmitted to my son. I saw the soldiers very close to him without wearing any masks or gloves. I am concerned about his health and safety, and I am afraid that he might be infected." Since the start of the lockdowns for COVID-19 in Palestine and Israel, human rights organizations registered an increase in settlers' attack. Much like night raids, nighttime attacks by settlers add yet another layer to the traumatization that Palestinian families experience. UN OCHA, for example, recorded 143 settler attacks that led to injuries or property damage, of which 55% were recorded during the first months of the lockdown, representing a level higher than previous months and also higher than the months in the average recent years. The impact of such attacks on women and children are fear, anxiety, and lack of safety, especially in Hebron H2 area, which is where Palestinians can access little justice and the settlers are protected by Israeli soldiers. A woman from Tel Ermeida H2 area explained, "We live in fear, anxiety, and constant psychological stress given the increase of attacks in light of COVID-19, especially when moving through checkpoints and in presence of settlers. The settlement of Beit Hadassah is 7 meters away from my home." Additionally, WICLAC documented violations against Palestinians' right to health by settlers caused particular violations in the context of the current vulnerabilities in health, access to water, and sanitation because of COVID-19. A woman living in H2 area in Hebron said that settlers added unknown substance to their domestic water tank, forcing them to go without water during the pandemic for almost 48 hours before the Palestinian ministry could replace it. In many testimonies, women have repeatedly reported settlers spraying water or unknown substance in the streets near Palestinian houses. In addition to spitting on Palestinian homes, and as reported by a woman from H2 area, she said, "The settlers do harmful activities. For example, they spray liquid substance on the doors and cars of Palestinians, and we do not know what the nature of these substances are." The residents asked the Palestinian Authority to examine the liquid material that are sprayed. The demolition of Palestinian residential structures in Area C and East Jerusalem has left hundreds of Palestinians homeless while suffering from financial and psychological impact of the demolition. Despite the Israeli authorities declaring their intent of suspending demolition of inhabitant infrastructure during COVID-19 period, the year of 2020 marked the second highest year of house demolition since 2009. WICLAC believes that the disproportionate impact of house demolition has on girls and women, and with the global pandemic, there is an added threat of violence against them. Since many Palestinian women are the caregivers in their homes, ensuring sensitized environment amid the targeting of sanitation infrastructure during COVID-19 is a main concern that has become difficult to fulfill and nearly impossible without shelter. With many impacts of COVID-19, women have particularly vulnerable to the effect of not being able to access healthcare and health information. In terms of contracting the disease itself, the statistics in Palestine have run contrary to the global trend and shown that more women than men have tested positive of COVID-19. The reason behind this are still not clear, but many may be connected to women's disproportionate participation in healthcare and their informal caregivers role.
Amal, would it be possible to conclude, please?
Yes. Women getting cancer treatment interviewed by WICLAC expressed their concern and constant state of fear due to the movement restrictions between West Bank and Gaza. As for preventing the spread of coronavirus, the only procedure that is taken is like the body temperature upon entry of the facilities. And finally, let me highlight that Israel must take full responsibility for the health of Palestinians in the occupied Palestinian territory and genuinely cooperate with Palestinian authorities in the West Bank and Gaza to ensure their health needs are met to the highest attainable standards. The international community must publicly assert that responses of the COVID-19 pandemic should be grounded on the right to the highest attainable standards of physical and mental health services without discrimination. Thank you very much. Thank you.
While our speakers have focused today on the situation of Palestinians on both sides of the Green Line, we must not forget that Palestinian refugees, as mentioned by the Special Rapporteur, in general are also very vulnerable in situation of vulnerability worldwide, but also Palestinian refugees living outside of mandatory Palestine who have been denied the right to return to their homes and properties are disproportionately affected by the pandemic in neighboring countries, including in Lebanon, where, for example, the United Nations Relief and Works Agency, UNRWA, stated that the mortality rate from COVID-19 among Palestinian refugees is 3 times that of the country's general population. Our organization, as mentioned by my colleagues previously, urged the United Nations and UN member states to recognize and condemn Israeli policies, laws, and practices through which Israel has established an institutionalized regime of racial domination and oppression over the Palestinian people as a whole, amounting to the crime of apartheid. I would like to remind our colleagues who are attending the event that they are able to ask questions in the Q&A. And in the meantime, maybe I will take the questions we have. First, the question regarding, as Israel is not complying with providing right to health for the protected Palestinian population, what practical steps can countries take to oblige Israel to accomplish, to be in compliance with its obligations under international law? The other question is, what is the impact of COVID-19 on East Jerusalem hospitals, and how does that impact the health care provided by to the Palestinians in the West Bank and the Gaza Strip? Also, how can we ensure protection to health workers? What can be done to hold various stakeholders accountable? And just to say, if we can go in the order of speakers, so starting with Budur, to have the to answer whichever question you would like to answer and provide your concluding observations. Everyone can have 2 minutes. Thank you very much. Budur, you are muted. I'm sorry. Yeah.
So I will focus specifically on the question regarding the effect of the pandemic on Palestinian hospital in Jerusalem. So we have basically 5 Palestinian hospitals in Jerusalem, or 5 to 6 basically. And there are specific hospitals, for example, like Al-Maqasid, which has been treating patients with coronavirus. Before the pandemic, especially during the 2 years before the pandemic, the Palestinian hospitals in Jerusalem have faced unprecedented loads, both due as a direct result to the United States withdrawing its funding to these hospitals, and also in addition to Israel's, as we said, Israel's development of the Palestinian health sector in East Jerusalem. So these hospitals had already been ill-equipped to deal with the pandemic. So, there was first this problem of actually having access to some equipment necessary, although the Israeli Health Ministry did grant Palestinian hospitals that treat patients of pandemic patients some funding that was far from enough to accommodate their needs. In addition, we are not only speaking about the pandemic per se, because there are also other health problems that Palestinians need to be treated for. So Palestinian hospitals in Jerusalem that were not treating specific coronavirus, the coronavirus patients, were not given this funding, this additional funding. Also, there has been a problem with the transfers of Palestinian patients from the West Bank to Jerusalem, first due to the restrictions on the freedom of movement of Palestinians. And this has also limited and reduced the income of these Palestinian hospitals. So many hospitals like the Palestinian, the French, the Eye Hospital in Sheikh Jarrah, for instance, has suffered drastically due to the restrictions and to the limitations of the income that was afforded by Palestinians, patients from the West Bank entering Palestinian hospitals in Jerusalem. Both Palestinian patients in Gaza and Palestinian patients in West Bank, their freedom of movement have been restricted significantly and many of them have been unable to enter Palestinian hospitals in Jerusalem. I should also add that Palestinians who are living in Jerusalem but who do not have a permit or who have been denied their right to family unification have also been excluded from the access to healthcare. So all of this has really meant that the situation of Palestinian hospitals, which was already severe before the pandemic, has only been aggravated after the outbreak of the pandemic, and they're on a breaking point. I think the question regarding what practical steps should be taken, probably the rapporteur, the UN Special Rapporteur on Health, can really address this. I just want to add that we're now at a historical stage after the ICC has said that it does have the mandate to prosecute potential Israeli war crimes, including the crime of apartheid. I think this is a very important opportunity to prosecute possible potential Israeli crimes, including, as we said, the crime of settlements and the crime of apartheid, and Israel's and all the violations that amount to war crimes and crime against humanity, some of which have been highlighted by my colleagues. I think a message by the international community that they support the efforts of the ICC to uphold the rule of law is very important at this moment, instead of trying to undermine the efforts of the ICC. I think it's very important for third states as third parties to hold Israel accountable for its continued violations of Palestinian rights, including the right to health, the right to life, and the prohibition against torture. I think it's very important, instead of actually maintaining Israel impunity against all the crimes that it has been committing, for the international community, especially the European Union, to send a clear message to Israel that these continued violations are unacceptable. So this is what we have to say as Palestinian organizations, and I think that probably the rapporteur in the right to health has more practical additions on what third state parties can do in order to pressure Israel into equitably and safely distributing vaccination to the entirety of the Palestinian people under Israeli occupation.
Thank you, Budur. I will now pass the floor to the Special Rapporteur, as maybe you will have to leave earlier, and we can continue to address the comments a couple of minutes, taking over 3.
Okay, thank you so much. And I think, as someone who lived and grew up in apartheid South Africa, I don't have to imagine or read up on a textbook about research and to understand what's happening and the urgency of the issues. And I really just want to reiterate that the work that I do is really guided by the human rights principles. And it's so important, I think, at this time, to continuously remind states of their minimum core obligations, because most of them hide behind this idea that the right the full realization to the right to health is a progressive right, and therefore citizens must be patient. And in this instance, Palestinians, like you are saying, within the region and outside, are having and experiencing discrimination, some rights abuses, and some rights violations. And I would just urge all of you to perhaps use the United Nations special repertoires and use the online submissions that are available that will come, even if you send it, for example, to the special rapporteur on the right to health, and we find that there may be other issues on that information you are giving that we know that intersect with other issues that we know perhaps, like the underlying determinants of health and other issues that continue. And I agree with the previous speaker that COVID-19 is not the only problem, but COVID-19 is exposing existing structural fault lines, right? And existing human rights issues. And so I think it's very, very important where we as a globe, we have to take deliberate and concrete, steps, but also really understand that to combat this pandemic, we will have to go beyond what we even think under normal circumstances is, the extra mile. And often we hear about international cooperation and international solidarity, but I think it's important today to talk about regional solidarity. And of course, like I said, I live and I grew up in apartheid South Africa, so I understand, some of the challenges, and not to the same extreme, it's not the same, but just to say that, we all have some lived experience of how really heart-wrenching and completely unacceptable some of the allegations are. And I think on the website of the Office of the High Commissioner for Human Rights, there is a space where people can send in a submission form if you want to remain anonymous, and in where we feel that in an exceptional time we can withhold the people who have sent in the submission. I think it's very important also to remember that special rapporteurs are non-judicial, but the work that we do is very important to hold states accountable to the resolutions and the different treaties that they have ratified, and it's very, very important that we remain objective and we remain critical and remain independent. And whether it's international or regional human rights treaties or any alleged abuses of human rights, I think it's important for you to know also that they will remain private for about 6 to 8 weeks while the special rapporteurs concerned communicate with the state party involved. We have to send the letter as a letter of allegation, either on past rights violations or ongoing rights violations, on issues that are related not only to bills and policies, but also to practices that don't comply with international human rights laws and standards. And I know in many countries, especially in the situations such as the one that's been described today, people will often hide behind bills, legislation, and policy and say, but look at the text. We don't discriminate against anybody. But in practice, we know that they don't comply with human rights. And please, you are able to send those letters to us. And after that period of communicating with the government or the state involved, then the special rapporteurs then have to make that communication public. And you will then have access to it to then advocate within the region and internationally based on the types of replies and responses that the relevant parties have then given to us as communication, as information back. And I will just pause here. Thank you so much.
I just want to see if other colleagues have concluding remarks as we are over time. If there are none, I would just say thank you and to everyone who has joined us. Shahd, go ahead, I'm sorry.
If I may, just very quickly, I'm sorry. Regarding the question on the raid on the Palestinian Health Work Committees, I think it's important to note that this is not the first time that the Israeli occupying forces or the Israeli occupying authorities have hindered the work of medical care staffers who try to sustain the healthcare for Palestinians. They've blocked checkpoints, they've harassed medics, they've violated Palestinian patient privacy, and of course by the fragmentation because of the apartheid regime, there's a lot of restrictions on the medical rights for patients to receive necessary treatment. And I'm sure the closure on Gaza is one example of these restrictions. Regarding on the question on how we can or what the international community can do, I think it's very important that we or the international community start taking immediate and concrete and effective actions. We recall the active role that third states have played in bringing an end to the apartheid regime in South Africa. And from there, we remind the international community, including the Human Rights Council and its member states, that it's important to uphold the rights of the Palestinian people, including the right to self-determination and right to return, by adopting effective measures to overcome Israel's apartheid regime and, of course, the aftermath of that regime. One way to do it is, as Budur mentioned, is by providing coercive and public and compelling support to the independence of the ICC in all its operations, including when it comes to the investigation into the situation in Palestine. And also another way to do it is by ensuring the arrest and the transfer to The Hague of the persons investigated and accused of international crimes in the OPT. Thank you.
Thank you very much, Shahd. Does anyone have any additional concluding observations?
I'll just answer the question on Gaza, if that's okay, Nada. So very simply, just to say that the COVID-19 pandemic, quite simply, just added extra weight to a healthcare system that was already on the brink of collapse and added additional risks for patients seeking treatment there. So when I spoke about there being insufficient water and sanitation, this also applies to Gaza's hospitals and medical facilities. And then there's a lack of oncological treatment, so chemo and radiotherapy in Gaza. And so some of the people most in need of care are required to go through this labyrinth, slow, complex permit procedure in place by Israel within the closure system. And further barriers were placed in front of those patients as well, both in terms of additional restrictions and requirements from the Israeli authorities in terms of additional evidence required concerning their medical conditions. But then also due to the restrictions put in place by the Palestinian authorities in Gaza in terms of the 21-day quarantine that was in place for an extended period of time, also applying to Palestinian patients. So they'd be faced with the choice of leaving for urgent life-saving care and going through a 21-day quarantine in a center in Gaza, or delaying that care and possibly not getting a permit again in the future. And now patients, if they do get a permit, are required to obtain a negative COVID-19 test result. So yeah, it's pretty straightforward. The restrictions, the barriers have increased, the risks for patients have increased. And I'll just conclude by saying that it's so important to address the root causes affecting patients during COVID-19 in Gaza, and that requires the international community to take concrete steps to push Israel to fully immediately lift the illegal closure on Gaza and related mechanisms. Thanks very much.
If I may add one comment, please, just to pay attention actually to women or women with a Palestinian ID married to Palestinians with a Jerusalem ID. Women with the Palestinian ID living in Jerusalem are, let me say, disproportionately impacted by the situation due to the fact that their permits have not been renewed since the pandemic. Secondly, they do not really have the right to access to healthcare, either through the testing or to the vaccine. Secondly, we need to pay attention to women especially women with cancer, breast cancer, and other forms of cancer living in Gaza, and who's supposed to have their chemotherapy and their treatment either in hospitals in Jerusalem or in the West Bank. The Israeli authorities won't really give them the access permits to access the specialized hospitals in the West Bank or in Jerusalem. They do not really do the proper testing to them after finishing their treatment and upon returning back to Gaza. The only thing that they do, they only test their temperature, which is not enough. And most of the times, the testimonies that we document men fear contracting virus, taking into consideration that they are loaded, let me say, in overcrowded transportation while returning back to Gaza. So special arrangements should be taken into consideration for women with cancer in order to access their treatment or specialized treatment in East Jerusalem specialized hospital, and as well as I mentioned, Palestinian women with Palestinian ID living in Jerusalem, they should be granted the access to the treatment and to the access to the vaccination. Thank you very much.
Thank you very much. I would like to thank our panelists for this rich discussion and the participants also for taking the time to join us today. Have a good afternoon and thank you very much.